Hi, I welcome you again to my channel, and in today's video we are majorly going to be talking about constipation. Constipation is a medical condition that gets the the digestive system, and it is a condition characterized by hardened stool and difficulty in emptying the bowel or difficulty in passing out stool. In this video, we are going to talk about which age groups, which category, which type of people get constipation. And here I am here to elaborate that all people of all age groups get constipation. The young, the infants, the youth, the the elderly, anyone can get constipation at any point of time. But I'm going to tell you that constipation is more pronounced in pregnant women, in those people who have underlying chronic diseases like diabetes mellitus, those people who have hypertension, hypothyroidism, hypercalcemia, and also those who have anorectal disorders, for example, or those people who have hemorrhoids, who have anophysias, they tend to get constipation because each time they feel they have the urge to go and pass stool, they know that there will be pain down there behind there. They're going to feel pain. The stool is going to again cause the pain in the wounds that they have in the anus, in the rectum. So as the more they tend to avoid going to the toilet, so the more constipation will form and will disturb them. So those are the people who are more pronounced, who are more prone to getting constipation. And next I will be saying the what are the common causes of constipation. One, our diet. You find if you eat food with no roughages, with less fiber, roughages meaning cabbages, greens, the fruits, the cereals, if you don't eat enough of them, at the long run, you find that you will get constipation. Two are people who take less water, take less oral fluid. We call them oral fluids because water can be taken as plain water. It can be taken in form of juice. So anyone you take, as long as it is adequate, it is good for your health. But if you take inadequate, if you take very little or not at all, you are most likely to end up getting constipation. Then we have other things that cause, like I said earlier, that those people who have colon or anorectal disorders like hemorrhoids, anophysias, strictures, cancers of the, then those people, because they tend to avoid going to the toilet, the end result is constipation. Then we also have side effects of other medication, of other drugs that people take or someone is getting. So such also get constipation. Example of the drugs: if someone is taking a class of drugs called diuretics, the diuretics, they are the drugs we majorly use in hypertension to treat the pressures. They tend to drain a lot of water in the body. So as a result, someone can get constipation. We also have antidepressant drugs. Uh, so such people who are taking antidepressants also get constipation. Then we have the narcotic analgesics. Also, those ones at the end make someone get what? Constipation. We also have metabolic causes, like I said, who have chronic illnesses like diabetes, hypothyroidism. Those people get constipation because of those conditions. They end up getting what? Constipation. Then we also have people who deliberately tend to ignore the call of nature. If nature calls that go to the toilet, please pay attention and go. But if you don't go, if it has come knocking the first time you've refused, the next time it has refused, 3 times, then you just automatically know you're going to get constipation. So always, if you don't want to be constipated, please pay attention to the call of nature. When nature calls, please respond positively. So those are the causes of constipation. I was forgetting one. Lack of exercise also can cause, especially in the elderly and those bedridden patients. And of course, everyone, every other person also, because exercise is good. Generally, it's good. So let's keep doing exercises also to avoid getting constipated when it's not necessary. And the next thing we are going to see the clinical features. We are going to talk about the signs and symptoms of constipation. If someone has constipation, how do they come to you? They come to you complaining of, I have abdominal pain. They tend to have abdominal, not even just abdominal discomfort, depending on the stage. We have chronic constipation. That one that manifests with serious symptoms that the person is in severe pain. They tend to have abdominal pain. They also get straining when they go to pass stool. They strain a lot, and then they pass small hard volume stool. So those are the signs of this early constipation that is not chronic. But those people who have chronic constipation, who are in severe pain, they have severe abdominal pain. They there will be also abdominal distension. Abdominal distension meaning their stomach tends to swell. It starts to swell. Actually, they have signs exactly like that one of intestinal obstruction. The term we always use IO. So when you find such a person and you can't rule out if it's what, if it is an IO or it is constipation. So the next thing, if you receive a patient complaining of such, the best you can do is, or if you're not in the hospital setting and you're at home and the person is complaining of such, the first thing you should do is rush them to the hospital if the signs are of severe constipation or chronic constipation. And if they find you in the hospital, we're going to see the management, yes, but before we manage, you are actually going to first assess your patient, do a physical examination as a clinician or as a person on duty that they have got, or the doctor. You need to do a thorough physical examination, do abdominal examination, then also don't forget to do rectal examination. It helps us to rule out if it is just constipation or it is an IO. Then after doing those, you can now determine, because by the time you're finished doing an rectal exam, now you have an idea if it is an IO or it is just constipation. So if you've done an rectal exam and you find as if you're not very sure if it is IO or constipation, the best thing you do is send the patient for an ultrasound scan, barium meal, or barium follow through with an X-ray. It helps because in the management, as we are going to see, you will see that it's not just a matter of giving medicine. We are going to see now how do we manage constipation? How do we treat? It depends on which kind of constipation we have. These are the constipation with these signs which do not cause alarm, or with signs that are not pointing, that are not severe. For such a person, you just need to talk to them, give them a health talk. They should have diet rich of refuges. They must take enough, plenty of oral fluids. They must also do exercise, regular exercise. Then their problem will be sorted. Um, if that one can't work and the patient still continues complaining of pain, no passing stool, the best thing you do is we have local enema. Even it can be done at home or in the facility. A local enema, here I'm just going to explain it briefly. Even a mother at home can do if the child is constipated. What you do, get a small piece of soap, push it in the rectum through the anus, push it there. Then give the child some time, like 5 to 10 minutes. The person will be able to pass through. Or what you do, get that soap, put in water, let it soak a bit, then get that liquefied form of that soap, get a syringe, aspirate, then put in the anus, inject like you're injecting, but without a needle. Remove that needle and you will inject and give it some 10 minutes. The person will be able to pass out stool successfully. So that is what even anyone can do at home, as long as there is someone with constipation. That is the best you can do. If that fails, in the hospital setting, give, if it's an adult person, give tablets, bisacodyl, 10 milligrams at night when the person is going to sleep, once a day until the person passes stool. If it's a child over 5 to 12 years, we give 5 milligrams. We push in the rectum. Then for those children, oral or rectal lactulose can work. But be careful when you're giving bisacodyl. Don't give bisacodyl if you have not confirmed that it is constipation. Because if you give bisacodyl for constipation when it is an intestinal obstruction, it means you're making the situation worse for the patient. And if the patient can't be attended immediately, we may end up losing the life of the patient. So be careful, be careful. I say again, be careful. Don't give bisacodyl if you're not very sure that it is only constipation. Okay? Okay, I hope you get the point. And now the last thing that I want to talk about in constipation here is the prevention. Since all of us we are prone to getting constipation, how do we see we can avoid getting it? Just like we've seen the causes, we've seen the age groups it gets. The best prevention is doing regular exercise, taking enough oral fluids like water, then eat foods rich in fiber or roughages. It will help better. I hope I have talked to a soul. I have talked to someone. Thanks for watching. Thanks for listening and giving your attention. Please, if you have any query, any question, leave it in the comments and I will answer. Thank you, but also please click on the subscribe button and like it. Thank you. See you in the next video.